Hello everyone. So the topic for today's video is hemochromatosis. Hemochromatosis is accumulation of iron in body from any cause. Hemochromatosis can be of two types. First is primary hemochromatosis. It is increased absorption of Fe, that is iron, due to mutation in HFE gene which is located on chromosome 6. The second type is secondary hemochromatosis, which occurs due to recurrent blood transfusion as in thalassemia. Next is clinical features. The first clinical feature is the first organ affected is liver. In liver, first hepatomegaly occurs, which further leads to cirrhosis of liver. The second clinical feature is increased skin pigmentation, that is accumulation of melanin, which leads to metallic sheen to the body, to the surface of the body, referred to as bronzing. So the skin becomes bronze in color. The third clinical feature that can occur in hemochromatosis is type 1 diabetes mellitus. It occurs due to direct damage to beta cells of pancreas. Fourth clinical feature is cardiac involvement, which leads to restrictive cardiomyopathy, and it presents as congestive heart failure. Most common arrhythmia that occurs in hemochromatosis is paroxysmal supraventricular tachycardia. Fifth clinical feature that occurs in hemochromatosis is arthropathy, that is, joints are involved. Firstly, the first joint to involved is second or third metacarpophalangeal joints. Sixth clinical feature is hypogonadism. It occurs because of pituitary damage, which presents as loss of libido and impotency. Then there is a hemochromatosis triad, which is a triad of three symptoms. First is bronze skin, second is diabetes, and third is hepatomegaly. Next is the investigations that can be done to diagnose hemochromatosis. Firstly, we can measure serum ferritin level, which will be elevated. Second is percent saturation of transferrin, which will be more than 50%. Normally it is around 25%, but in hemochromatosis it will be elevated to more than 50%. The third investigation that can be done to diagnose hemochromatosis is a gold standard for diagnosing hemochromatosis is liver biopsy. Then finally, the treatment for hemochromatosis. To treat or to relieve the symptoms of primary hemochromatosis, phlebotomy can be done. And for secondary hemochromatosis, we can use iron chelators, that is deferoxamine, to relieve the symptoms of hemochromatosis. This leads to the ending of our topic, which is hemochromatosis. Thanks for watching the video.